Hello, and welcome to this edition of Safe and Sound. I'm your host, Doug Bolnick. To recognize the tragedies of 9/11, many of us seek opportunities to give back to our communities at this time of year. There are many ways to contribute to your neighborhood, and we'll discuss a few of those here in this episode. To provide further aid for growing families, Eva Obirek from St. Charles County Women, Infants, and Children Program, better known as WIC, will give us a look at many of the improvements made to this wonderful program. Then we'll visit with Community Council of St. Charles County Director Mary Hutchison, who will explain the impact that volunteers can make on our county, and we'll discuss how you can get involved. We all understand that emergencies can happen at any time. Sheila Harris-Wheeler will provide us with information on a group designed to help us out after a disaster. After that, we'll talk with St. Charles County Community Health Nurse Shelly Reynolds about ways that we can protect ourselves and our kids from illness. Lastly, we'll visit with St. Charles County Pet Adoption Center to understand the best way to interact with an unfamiliar or aggressive dog. But first, parents, siblings, and other relatives play a big role in the child's development. To explain this influence and to offer suggestions on how to become more involved in the development of the ones you love, we've invited Ann Young from the National Headquarters of Parents as Teachers to talk with us today. Welcome, Ann.
Thanks.
Parents as Teachers has been around for a long, long time, but not all of our viewers may understand what you do. Would you mind telling us?
Sure. Parents as Teachers is a home visitation model where a parent educator goes into the home to visit with children and families once to 2 times a month. And they talk about child development, family well-being, they set goals with families, and overall family development.
How could a parent sign up to join this program?
Here in Missouri, especially St. Charles County, there are programs in each of the 6 public schools. So families can call their local school district and get enrollment information through there.
And once they do sign up, what's typically the next step?
Well, they will be contacted by a parent educator who will tell them about the components of the program. There are personal visits or home visits. There are group connections, screenings, and parent resources. If their home visitation portion is full, they will be able to attend group connections, they will be screened, and they will get resources as needed.
Could we talk about what a typical home visit entails?
Sure. Parent educators will meet with the family. They'll talk about what happened on their last visit. They'll check in to see if anything is anything different is going on with the child or the family. They will talk about what they're going to discuss on this visit, specifically what child development skills they're going to talk about, what activities they're going to do to promote that, and anything else doing with well-being. So, for example, if a parent educator brings a book, like this book that I have, you may just say that it's just a book and we're just going to read it. Well, this book can offer so many different activities. They can talk about the colors in the book, because this book is definitely has a lot of different colors in it. They can practice fine motor skills by turning the pages. And at the end, this book specifically speaks about children's moods. And so this helps the parent educator work with the parent on helping the child identify the mood that they may be in. And so they can spin this and say, how are you feeling today? I'm feeling happy, I'm feeling sad, I'm feeling scared.
And is the Parents as Teachers program just for first-time parents?
No. Parents as Teachers program is for any parents with a child. Actually, it's prenatal to kindergarten entry.
How does a parent sign up to join Parents as Teachers?
Well, Parents as Teachers is operated through the public school system, but it's open to anybody. So parents who have children in parochial schools, or if they're homeschooling, or if they're just staying at home with their children, are eligible to receive Parents as Teachers services.
Thanks, Ann, for some really interesting information. Another program helping mothers, infants, and young children obtain nutrition education as well as supplemental foods that will enhance their growth is St. Charles County's WIC program. To show off their new facility and to introduce a few improvements, Program Coordinator Eva Obirek will take us on a tour.
Women, Infants, and Children, also known as WIC, is a supplemental nutrition program that provides services to our women postpartum women, also breastfeeding moms, infants, and children up to the age of 5. The services that WIC provides are health screenings. We also provide nutrition education, nutrition counseling. We provide ongoing breastfeeding promotion and support to our breastfeeding moms. And we also provide healthcare referrals for our clients. WIC program eligibility is actually partially based on income guidelines. The income has to be at or below 185% of federal poverty levels. The participants will also go through nutritional screening to check for nutritional risks. And once the participant is found to be eligible through income screening and through the nutrition assessment, they will enroll into the program and will be eligible for the program depending on the WIC category. For example, our prenatal moms will be eligible till the baby is born, or postpartum moms are eligible for 6 months, and then our breastfeeding moms are eligible for 1 year. All of our infants and children are eligible for 5 years. We have made several changes to our clinic here at St. Charles County. The major changes were to the structural design, which evidently led to change in the clinic flow, which consequently resulted in better customer service. The change to the clinic flow allows for the families to complete their WIC appointment in much less time than ever before. We have also added books for children in the waiting room. We have also added educational TV station for them to watch while they wait for their appointments, which also made the waiting room much pleasant. It also made it more quiet. Our parents are satisfied with how their children are taking advantage of the books and reading them while they wait. Those small clinic changes also made the WIC appointment much more relaxed for the parents. And I also can notice the changes in our staff. The staff is much more relaxed as well. The St. Charles WIC clinic is an appointment-based clinic. Therefore, somebody that wants to enroll into WIC will need to set up an appointment with us first. Our staff is very accommodating to the parents' needs, and will try to give everybody the earliest appointment available that meets their needs. Once the participant is here for initial certification, they will meet with our WIC staff to have their income assessed. And once they are found income eligible, they will move on to meet with our nutritionist staff, which will complete the nutrition assessment and screening for them. The final step of the visit will be printing out the checks, and the checks are based on the food prescription that the nutritionist will build with the client based on their nutritional risk and assessment. Once those checks are printed, the participant will sign off on the checks. The staff will explain the redemption process of the checks in the stores, and finally set up a follow-up appointment for nutrition education and also nutrition counseling with the client. What makes our program unique compared to other food assistance programs is that WIC provides continuous nutrition education and nutrition counseling, referrals, breastfeeding promotion to all of our clients, past their not only supplementing with the checks and the foods. Missouri families that would like to enroll in the WIC program here at St. Charles can call our direct phone line at 636-949-7402. That information is also available on our website.
Thanks, Eva, for everything you and your staff give to the community. Speaking of giving, we hope you'll stay with us, because when we come back, we'll discuss what you can give and what you can get from volunteering.
Over 13 million people are affected by famine, war, and drought in the Horn of Africa.
Make a simple text donation of $10.
But do more than donate. Forward the facts.
Welcome back to Safe and Sound. I'm Doug Bolnick. On today's episode, we're offering suggestions on ways that you can contribute to making your community better. Next on the show, we'll travel to the Community Council of St. Charles County office inside the Spencer Road Library, where the organization's director, Mary Hutchison, recommends how to get the most out of volunteering.
People are more discriminate and choosy and looking for volunteer opportunities these days, and that's a good thing because they're looking for experiences that are meaningful to them and where they can really make a difference and use some of the skills and expertise that they bring in a meaningful way in the community. I think they're being more discriminative because they can do that, and because nonprofit organizations are looking for higher skilled volunteers, and they're opening up and creating many new opportunities that never existed before in the volunteer world. There are so many different volunteer opportunities available in this community. There's a rich number of nonprofit organizations that serve a wide variety of people. So there are many different categories that people can consider when they're looking for a volunteer opportunity. They might they want to consider what their passions are. Some of their own life experiences often lead them to different organizations. So if they have a family member that has experienced a certain kind of illness or who has a developmental disability, they may want to look at the many different organizations who serve people with disabilities in the community. But also there are many people that have children, and therefore they want to work with children, improve the world for children, and there are so many of those kinds of organizations, as well as organizations that serve elderly in our community. In addition to that, many people really want to help people in need, those people that have a hard time making ends meet, and there are many organizations that are out there just to provide basic needs to organizations, whether that's food pantries or shelters. So there's a rich variety of organizations, and that's often what drives people to a volunteer opportunity. But you might also want to consider geographic location. Sometimes transportation and availability and just making it easy to volunteer is something you want to consider. So you look right in your neighborhood or in your municipality and focus on that. Some people don't realize that there are volunteer opportunities not only at nonprofits, but at schools, at churches, at city government, at county government. So all the sectors, whether it's private, nonprofit, or government agencies or faith-based, all use volunteers, many service organizations. So those are great places. Additionally, I encourage people to consider volunteering on a one-time basis, like an episodic volunteer, where they're volunteering for an event, maybe a fundraising event, and they can check out an organization. And that's a good way to find out, whether or not you like the people that you'd be working with before you make a long-term commitment. So consider doing maybe a project or an episode and actually interviewing an organization and determining whether or not that's a place that you want to volunteer. If you're looking for a volunteer opportunity in this community, there are many ways to go about searching what's available. One of the resources that Community Council has on its website is actually a directory, and it's called Your Invitation to Serve. And it lists organizations and gives you their contact information. But you'll also want to look at United Way's new website, and it's called Hands on Connect website. So if you go to United Way, you can search for volunteer opportunities all throughout the metropolitan area. That website will just get better and better as more organizations find out about it and put their volunteer opportunities there. There's a website called Volunteer Match. That's another great website to take a look at. And then I encourage you just to go to the website of different organizations. Again, the local municipalities all have volunteer opportunities on their website, and many organizations, if you go to those organizations, check them out. And then again, just call the organization, ask for the volunteer coordinator, and interview them. Find out as much as you can about the organization before you make a decision. The Community Services Summit is an annual event for Community Council, and it's one of our largest. This year it's taking place October 8th, and it's held at Harvester Christian Church. This is a half-day event that I encourage anybody in the community, if they want to learn about all the community resources that are available, to come and take advantage of this event. Because part of that event provides a community resource fair where there'll be exhibits of 90 different nonprofit organizations throughout the community. You have an opportunity to talk to professionals from those organizations about what they do and what their programs and services are, what their volunteer opportunities are. So you would go to the Community Council website to learn more about the Community Services Summit. It does focus on children and families. You'll also have an opportunity to go to 3 breakout sessions where expert speakers will talk about the emerging issues and topics that face children and families today. If you're interested in coming to the Community Services Summit, go to our website and you'll find there a link to how to register for the summit. There is a cost of $15 to attend the summit. We're also open for exhibitors or those that want to exhibit their programs and services to the community, and you'll find information about those exhibitor fees. And all of that takes place in August, so August through September, and you'll find that on our website.
Thanks, Mary. I hope that many of you will join me in volunteering your time to help our community. This year, St. Charles County residents were impacted by events like spring tornadoes and flooding, devastating home fires, and much more. I've invited Sheila Harris-Wheeler of Crider Health Center and chairperson for a group called Community Organizations Active in Disaster, also known as COAD, to talk with us about resources available should we ever face another emergency. Thanks for joining us today, Sheila.
Thank you for having me.
When large-scale disasters like the floods or the tornadoes do occur, people automatically assume that the federal government's going to come in and take over. That's just not true, is it?
No, that is not true. And the federal government has two forms of assistance that they provide or could provide, and it's based upon the needs of the area. There's public assistance, and that generally goes to reimburse people for sandbags or debris removal after a large storm. And then there's individual assistance. And individual assistance is really based upon the area and whether or not those folks have enough resources to take care of that area. And that's why a COAD is so important. If there are folks that do not have resources, do not have the means to take care of whatever happened to their home, then that's where a COAD would come in, because not always is there going to be a federal declaration for individual assistance.
We keep mentioning the acronym COAD. Could you explain what that really stands for and just an overview of what that organization does?
Yeah. A COAD is Community Organizations Active in Disaster, and it's nonprofit organizations, non-governmental organizations, churches, individuals, volunteer groups that get together and assist families and individuals in need. It's the disaster human services component for a disaster and the response to that disaster.
In a large emergency, people may feel overwhelmed, but if you had a team of people working together, they can often accomplish a great deal. What are some of the things that organizations can do during a disaster to help out?
Well, first and foremost, they can join the COAD, because our COAD in St. Charles County is directly linked with the Emergency Management Office for St. Charles County. So we work hand in hand with the Emergency Management Agency. They tell us where we can be, where it's safe to go into, and then we assist those families in need. So we work in conjunction with the Emergency Management Agency. So we invite all organizations to join the COAD. We have several different committees. They can pick which committee that they want, or they can belong to many different committees. And from there, they can find out what's going on within the community, how we would respond in a disaster, and where they're needed.
COADs, it's not just functioning during an emergency. A lot of times the things that you do is proactive in nature. One of those things was the Tri-County faith-based event that was held earlier this spring. Could you give us an overview of what that event was and what it hopes to entail in the future?
Right. We look at the faith-based workshops that we have been doing in the faith-based initiative as a way in which to enhance and provide support to COAD, because it's all of the churches within the Tri-County area that can come together, and they can work on both different things. They can work on getting their own congregation prepared in the event of a disaster, because everyone individually should be prepared, as we know. And then they can also reach out to their friends and their neighbors in times of a disaster. And there's churches who want to do that. They want to belong. They want to know how they can help their neighbors. And this gives them a mechanism to come into and to work within a system.
Sheila, thanks a lot. It's nice to know that people are out there in case of emergency and we're not out there on our own.
Thank you, Doug.
Don't go anywhere, as we'll be right back.
Have you heard of Rett syndrome? I hadn't until my niece Courtney was diagnosed. The International Rett Syndrome Foundation hopes to find the families affected by this devastating disorder. Please call 1-800-818-7388 or visit rettsyndrome.org today.
Welcome back to Safe and Sound. During the last several years, cases of pertussis, better known as whooping cough, have been on the rise across the United States. St. Charles County Community Health Nurse Shelly Reynolds is here to help residents protect against this spread. Thanks for joining us today, Shelly.
Thank you.
What is pertussis and what are some of the symptoms?
Well, pertussis is a highly contagious respiratory disease. You know, it generally starts with a cold-like picture, a runny nose, scratchy throat. Very rarely is there a fever present. And then it progresses to a cough that just keeps getting worse and worse. Oftentimes, people will have episodes where they will whoop or gasp for air. Sometimes there's throwing up present after the episodes of coughing, but many times adults and very small babies won't have that characteristic whoop. The illness will sometimes last for upwards of 6 to 10 weeks, and that is where it gets the nickname the 100-day cough.
We talked a little bit about the symptoms for pertussis, but sometimes there's some pretty major complications. Who's at risk for those?
Well, pertussis can affect any age group, but it can be especially hard on the little ones, especially babies, because they're not fully immunized. Unvaccinated children are more likely to be affected than fully vaccinated children. And adults are responsible for transmitting more than half of the whooping cough cases to children and infants.
Speaking of adults, when we think of immunizations, we think of vaccinations and diseases, we only think that that's something that school-age children are affected by, but that's just not true, is it?
No, not at all. Many times people think that immunizations are just for children, but protecting our health really is a lifelong project. The CDC recommends a single Tdap, which is the tetanus with pertussis booster for 11-year-olds through adulthood, and especially for those who are in contact with babies. Now that would be caregivers, babysitters, daycare providers, grandparents, and this would be in an effort to cocoon or protect the babies. This is really important. They also mandate that any children that are starting 8th grade also receive a Tdap booster. It's also recommended that pregnant women during their 3rd trimester of pregnancy receive a Tdap booster. Also, many area hospitals are administering the Tdap booster before moms and babies go home from the hospital.
You talked about getting the Tdap vaccination, but how could somebody do that through the Division of Public Health?
The St. Charles County Immunization Clinic can provide the pertussis vaccine. In addition to that, other vaccines free or for a nominal fee during normal business hours. They provide vaccines every day except Thursdays and holidays. The hours are 8:30 to 11 and again from 1:30 to 4. They would just need to call to check eligibility requirements. The phone number is 636-949-1857. They can also go to our website and check out the public health section.
Thanks for the information, Shelly. It is estimated that dogs bite more than 4.5 million Americans each year. There are several simple steps that you and your family can follow to reduce the possibility for a dog bite. To further explain these tips, we'll visit with St. Charles County's pet adoptionist.
Interacting with an aggressive dog, especially a dog that is unknown to you, can be a very dangerous situation. The most important thing to do and to teach children is to stay away from dogs that are unknown to you. Any stray dog is a potential threat, so just stay away from them. But if you happen to encounter a stray dog that is aggressive to you and you need to protect yourself, then the best thing to do is freeze. Children and adults alike should simply freeze and not move. They should not scream, not yell, and not move. Just stand straight. We teach children to stand straight like a tree and just don't do anything. Let the dog sniff you if they want to, and then they will, if there's no motion, they will usually just walk away. And then if you can, back away from the animal slowly. Do not turn your back on the animal and get to a safe spot where you can get something between you and the dog, like go inside a house or get into a car or get up on top of something where the dog can't get to you if the dog decides to attack. One of the most important things you can do to make a dog more comfortable, or a family pet more comfortable around other animals and around people it's not normally exposed to, is through socialization. We encourage everybody who has a puppy to socialize that puppy from day one with other animals, not only other dogs, but cats and other types of animals, and take that animal places with you, like on walks where it gets exposed to large noises, crowds, things like that, and do that slowly. slowly. You should never inundate an animal, a new animal to your home or a puppy, with everything all at once. But it's very good to slowly socialize the animal with a bunch of different people, a bunch of different animals, and a bunch of different sounds and places and different kinds of like different yards and asphalt, things like that. The more exposure a dog has in a safe environment, the better the dog is going to be in handling stressful situation, and it's going to be a dog that you can take safely to a park or to with a ride in a car, do things like that with the dog, and the dog will be comfortable and confident and safe. Dogs are considered personal property, or pets are considered personal property. So any damages or any kind of harm that that dog or that pet should cause is the total responsibility of the owner. So if your dog bites somebody, you are legally responsible for the actions of that animal. If the animal damages other person's property, then you're legally responsible for that damage to that property. As an owner of any pet, you should always consider making sure that your pet is a good citizen by training them, socializing them, making sure that they're not going to be aggressive to other people or other dogs, because even if nothing terrible happens and your dog attacks another dog, you could still frighten somebody, you could still become a bad neighbor, and you could still cause a lot of problems in your own community if you have a dog that doesn't get along well with other dogs or with other people. Most dogs are friendly dogs that do not harm people. Most pets that people have in their homes are not animals that are going to harm somebody. But things happen. Even with nice pets that are friendly and well behaved, they can often bite somebody or cause harm because of something that happens and that nobody's expecting. So the best thing to do is always expect the unexpected and to teach children to be safe around animals. Most dogs that bite children, those children know those dogs. They belong to friends, neighbors, or relatives. So these are dogs that these children have been exposed to in the past. So teach your children to behave certain ways around animals, and adults need to do the same. There are certain things that you can do that will make it more likely that you'll be bitten by a dog. Dogs bite when they're afraid, or when they feel threatened, or when they feel they can't get away from something that might be a threat to them. And even somebody going up to their food bowl could be in their minds a threat. So you need to be cognizant that not everything that you consider a threat is the same thing that the dog will consider a threat. Always approach animals safely. Children should be taught to just stay back and let the dog approach them. And then when they reach out to pet the dog, it should never be a hand over the top of the head. It should always be let them smell your fist first, and then pet the dog underneath the chin and on the throat area, which is more non-threatening to an animal. So how you approach a dog can be very important. Never come right up to one, walking fastly, and tower over a dog, because they do consider that a threat. Always keep the sounds quiet so you don't scream or yell, which can frighten an animal, and never approach a dog that's cornered, because if they are cornered, they really only have one option. To get away from you, they're going to have to use their teeth to do that. They're going to basically fight you, and they're going to bite you to get away. All people who are bitten by either a dog or cat in St. Charles County need to call the Department of Animal Control or St. Charles County Humane Services as soon as possible after the bite. The very first thing that you should do if you are bitten by a dog or a cat is to wash the wound out with soap and warm water for at least 5 minutes. Every person, child or adult, should be washing that wound out to make sure that you're protecting yourself from any disease. But secondarily, that animal needs to be found, or we need to know where the animal is, and then the call needs to be made to the Animal Control Department so that a report can be taken and the animal can be quarantined and made sure that there's no disease being transferred to the victim from the dog or the cat. So every hospitals and doctors are required to report dog bites, and you should report them too. Even if it's your own dog, there are certain things that the health department wants you to know if you are bitten by a dog to protect your health and your family's health, and there are other things that we want you to know too about how to control a dog that is showing aggression and what you may be able to do to prevent that from happening again in the future. Keep in mind too, many dogs bite, and most of the dogs that bite are not terrible, bad, vicious dogs. They're accidental bites, or they're bites that were caused because somebody did the wrong thing, and it's not necessarily going to be a behavior that you see repeated. So don't panic if the dog bites your family member, or if the dog is out and it does show aggression. There are many times that you can change that behavior and stop that behavior so it never happens again, and the dog can become a good citizen and your family can be safe.
Well, that's all the time we have today. I hope that you've learned some helpful information to help protect the ones you love. Please join me next time to discover more ways to keep your family safe and sound.